Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about a patient I was able to help with hyperthyroidism and help her get her issues resolved without drugs or surgery. So this is a 29-year-old woman that came in to see me who had 6 years prior had been diagnosed with hyperthyroidism or Graves' disease, and she had been prescribed medication. She took the medication for 3 years, started weaning herself off, was doing okay. Then last year, her symptoms came back. So she went back to her endocrinologist, and the doctor said, listen, there's only two options. One, surgery to get the thyroid removed, and two, radioactive iodine. And at the time she was breastfeeding her infant, so she would have had to stop breastfeeding and no longer be able to do it with the radioactive iodine, and she didn't want to get the surgery. And she said, well, isn't there any other options? And the doctor said, well, no, this is it. There are no other options. It's either the radioactive iodine to destroy the thyroid because it's overactive, or the surgery to take it out and then thyroid medication the rest of your life. So she didn't want to do either one of those two, and somehow she found her way into our office, and I did a thorough evaluation with extensive lab work to really find out, well, what's causing this? At one point you were normal, it just doesn't come out of nowhere, this hyperthyroidism, this Graves' disease. So my job is to find out the underlying root cause. So that's what we did. And what I found out, by the way, the symptoms she was having was anxiety, nervousness, racing heart rate, heart palpitations, insomnia, hot flashes. She was having itchiness, itchy rashes, acne, digestive issues, bloating, gas, indigestion, difficulty gaining weight, excessive perspiration, just brain fog, just really memory and concentration issues. He was just feeling really, really terrible. So what when we're looking at autoimmune conditions and of the thyroid, there's Hashimoto's, which typically cause underactive, and Graves' disease, which causes overactive thyroid, which is what she had. We look at what's causing it. So we look at physical, chemical, and mental stress. And under chemical stress, we look at number one is deficiencies. So in her case, she had very low levels of iron and B12, and she was anemic. So that's one area. She was low in magnesium, vitamin D, and vitamin D is really vitally important for thyroid function and the immune system in general. And then found out she was low in iodine, very low in iodine, as a matter of fact, one of the lowest levels I'd ever seen. This was interesting because with hyperthyroidism, Graves' disease, giving someone iodine is really a no-no. Like, it's supposed to make them worse. So she was severely deficient. So I decided, do I give her iodine or not? So I'll answer that in a few minutes, but then we went on to toxins. So there's deficiencies, toxins. She had very high levels of fluoride in her system, which can interfere with thyroid function. And she had, under pathogens or infections, she had dysbiosis or bacterial imbalances in her gut. Too much of the bad bacteria and not enough of the good probiotics. And under food reactions, so we look at deficiencies, toxins, infections, food reactions. She had food allergies to wheat, eggs, almonds. She had different food sensitivities. Well, mainly gluten. Her main issue was gluten and wheat sensitivity, which I almost always see. Almost every patient that walks in with autoimmune condition has a gluten sensitivity. So that was a big big major finding there. And all this was causing leaky gut, and leaky gut is often tied in as well with autoimmune conditions, certainly Hashimoto's and now Graves'. So those are the areas that we found, and so then we worked on correcting it. And well, what's the answer as far as resolving this? Well, as far as the first thing is diet, and the diet that I came up with over the years, I call it free diet, because it's not only free of gluten, but gluten, grains, sugar, yeast, dairy, legumes, soy, all those foods that are most commonly responsible for inflammation, autoimmune, and chronic digestive and other health issues. So she went on the free diet. And by the way, there is a link to a download if you want a copy of phase 1 of the free diet. Just click that link below and I'll put that in at the end. So besides the free diet, put her on our natural medicine formula, so specific nutrients to correct her deficiencies. So I put her on our basic 5, which is multivitamin, fish oil, magnesium, probiotic, vitamin D, and she was deficient, so relatively high levels of vitamin D with vitamin K2 for absorption. Also, she was low in B12 and iron, so we added those nutrients in. Leaky gut, so we use a product that we have called GI Men's curcumin, vitamin C with bioflavonoids, and then acetyl L-carnitine, which is an antioxidant, and that can be really helpful for thyroid hyperthyroidism. And then use selenium and iodine. So yes, I did use iodine, a rather large dose, because she was so deficient. Again, and I don't recommend you going out and doing this, because before you take iodine, you need to be tested. Like, I wouldn't have given her, any patient, iron unless they were low on iron, because too much iron is toxic. Same thing with iodine. If she wasn't low, if someone's not low, then they don't need iodine. It can be more harmful. However, she was very deficient, so I gave her a relatively high dose of iodine. In 4 weeks, rechecked her lab work. She came in, and her hyperthyroidism had cleared up. I mean, it was normal on her labs. And at 2 months follow-up labs, her numbers were even better. And we have been monitoring ever since, and her levels have been fine. No more hyperthyroidism, which is amazing. Her symptoms all cleared up, like, the fast heart rate, the anxiety, the digestive issues, the itchy rashes, the insomnia, all that stuff cleared up. And she's just feeling great. So I thought I would share that with you, and just knowing that there's really 2 ways to treat these autoimmune, thyroid, and other chronic health issues. You can choose medicine, medication, surgery, procedures. You can go the traditional route, which that's fine if that's what you want to choose. On the other hand, if you want to choose health and really get to the underlying root cause of your condition, then and only then can you provide it with long-term permanent solutions so that you can get better. And I do believe that everyone can get better if they're provided the right solutions on how to do so. Thank you for joining me today. If you like this video, feel free to give us a thumbs up and like my channel on YouTube. And also down below is a link to the free diet phase 1, copy of that. So feel free to download that and check that out. So thanks again for joining me today. I really appreciate it, and we'll see you next time.